This is Dr. Dennis James Absin, a neonatologist, and we will be discussing this topic on prematurity. Globally, we have here some quick facts about newborns. So, around 2.5 million babies die during the first month of their life, and actually 1 million babies die on their birthday. That means after they're delivered. And 47% of under 5 deaths are actually comprised of neonatal deaths. In the Philippines, we have here data as to the leading causes of neonatal deaths. This was taken in 2017, that was just a little over 3 years ago, and it revealed that 31% of neonatal deaths are actually comprised of preterm birth complications. So that is the highest percentage as to the cause of deaths in newborn babies. So prematurity, the problems associated with prematurity, is actually a very significant problem as it pertains to neonatal and child health. So we have here some facts about preterm birth. Prematurity or preterm babies are those who are delivered before 37 weeks of gestation. And one baby in 10 actually is affected by preterm birth. And this is data taken from the United States. And prematurity can affect the health throughout the whole life of particular persons. So we are aware that prematurity may have a lot of complications, and moving forward as they grow, these preterm babies as they grow, they tend to have many complications which will follow them throughout life. So it's very important that regular follow-up assessments are done on these preterm deliveries who grow up eventually. And prematurity, as we've said, is the main cause of death under 5 years. And babies born preterm face higher risk of poorer long-term neurodevelopmental outcomes, because this is one of the complications that we look into, that we're assessing and evaluating through the years once a baby is delivered preterm and who survives the neonatal period. So the earlier a baby is born, the higher is the risk for poorer long-term outcomes. Okay, but not every preterm born baby has a poor long-term outcome. We've had really good outcomes, even with babies who are delivered very premature, who belong to the extremely low birth weight category of preterm deliveries. So additional facts, 15 million babies are born too soon every year who are delivered premature. And we have here 5 countries with the greatest number of preterm births. The Philippines is not listed among these 5 countries. Preterm boys are more likely to die than girls. So that's around 55%. Okay. Higher risk of preterm boys succumbing to complications of prematurity. And the outcome statistics for children born before 26 weeks, we have here 22% of preterm babies, those who are delivered before 26 weeks rather, would have a severe disability. And 24% of these deliveries would be associated eventually with having moderate disability, 34% with mild disability, and only 20% of those delivered preterm before 26 weeks would have no problems. And the annual cost of caring for babies in the NICU, this is data from the United States, is actually $26 billion per year. So that's a really significant amount of money. Okay. So we also have here data that obesity among women of childbearing age, because obesity among women, pregnant women, is also associated with a higher risk of preterm delivery. So the statistics actually is that we have more obese women who are delivering, who comprise a big portion of the population of pregnant women. And therefore, we would expect also higher complications of a higher incidence of preterm deliveries. Okay, so we have here some data again. Okay, the risk factors, as shown in the picture, for preterm delivery would include pregnant with multiples, lifestyle. So that means there is the risk factor of maternal smoking or drinking, chronic medical conditions such as maternal diabetes, maternal hypertension, and mothers whose age would be under 18 years or over the age of 35. And the presence of stress would be risk factors for mothers who are pregnant and who eventually would deliver prematurely. So November 17 every year has been declared as the World Prematurity Day because we cannot, this points to the importance and the burden and the problem of prematurity, not just in developed countries or not just in developing countries, but also in developed countries. So this is also very true in the Philippines, where prematurity has been or has actually or is actually a significant problem among newborn babies. So we define the preterm newborn as those infants born before 37 weeks from the first day of the last menstrual period. So the category, if based on the age of this gestation, would be as follows. So those babies who are born or delivered before 28 weeks would be considered as extremely preterm, having extremely low gestational age. Okay, so these are referred to as the LGANs, so the extremely low gestational age newborns. And those delivered between 28 to 31 weeks are labeled as very preterm infants, and those from 32 to 36 weeks age of gestation would be moderate to late preterm infants. Now, in terms of birth weight, those belonging to less than 1,000 grams would be labeled as extremely low birth weight infants or ELBW, and those with very low birth weight or labeled as very low birth weight infants would be those below 1,500 grams, and babies delivered less than 2,500 grams would be labeled as low birth weight infants or the LBW. Now we have here the terms IUGR and SGA. So a lot of times these terms are being used interchangeably. So is that warranted? Can we use IUGR interchangeably with SGA or small for gestational age? IUGR is intrauterine growth retardation. So the terms SGA and IUGR are often used as synonyms. However, they reflect two different concepts. When we say small for gestational age or SGA, we are referring to a statistical definition. So it denotes a fetus or a neonate whose anthropometric variables, which usually we use the weight, are lower than a given threshold value computed on a set of fetuses or infants having the same gestational age. So this means once a baby is delivered, you take the weight, you assess the weight, and if this is lower than the third percentile, then we say this is a small for gestational age baby. So this is in reference to a particular measurement at a given point or in a given point of time. However, when we say intrauterine growth retardation, this refers to a clinical and functional condition and denotes fetuses unable to achieve their own growth potential. And this is assessed by ultrasound during pregnancy by a longitudinal evaluation of fetal growth rate. So that means that SGA is referring to a particular point in time when the weight was taken. However, IUGR would refer to a more longitudinal assessment. So if If upon assessment, like for example, a mother uh, has undergone, or a pregnant woman has undergone ultrasonography and a particular time, then this was repeated again after a month. And based upon the assessment, there has been a non-achievement of the growth potential of the fetus, then we say this is growth retardation. So if you have multiple measurements documenting inability to achieve the growth potential, then that is IUGR compared to SGA, which is a one-time determination of a newborn or a fetus weight, and that particular weight is or falls below the 10th percentile.